If you are here, you have taken an active role in bettering your life, no matter what stage of life you are in. The Banyan Treatment Center's podcast will discuss many topics like recovery, addiction, self-help, mental health, and so much more. It will provide you with tools to succeed, ideas for recovering, and how-tos on creating a better life. My name is Alyssa, and today's episode is about signs of a drug overdose. Today on our panel, we have Dr. Darren Mangiacarni. Thank you so much for joining us today. Why don't you go ahead and tell our listeners who you are and a little bit about yourself?
Yeah, sure. Thank you very much. I'm very happy to be here today. I am the Chief Medical Officer for Banyan Treatment Centers, and I oversee all of the medical care that we provide in all of our facilities across the country. I am board certified in family medicine. I did a 1-year addiction medicine fellowship, and I'm also board certified in addiction medicine. I hold a master's in public health policy, and I've been working in the addiction field for the past, 14 years.
Wow. Well, thank you so much for being here today to shed some light on this topic.
I appreciate you having me. Thank you.
With the persistent epidemic of drug use in our society, the prevalence of overdoses has risen in communities across the country. A drug or alcohol-induced overdose can happen to anyone. Today, our conversation will describe the symptoms of an overdose and ways to intervene if you happen to witness one. So our first question for you here, how does an overdose occur? What is the science behind it?
Yeah, sure. Simply put, an overdose occurs when you ingest more of a substance than your body can tolerate. Mm-hmm. There is an old saying in medicine that the dose makes the poison. And what that means is that any substance that's injected, even water, can be toxic and lethal if you take enough of it.
Interesting.
And there's only a certain amount that your body is able to hold on to, and the underlying physiology of the overdose is dependent on the particular chemical structure of the medication,
right,
or the substance that's been taken.
So what are some reasons that people overdose?
Some people overdose accidentally, and then other people overdose intentionally. An intentional drug overdose is often classified as a suicide, unfortunately. But the overwhelming majority of people who overdose are not trying to end their life, and they accidentally just take too much drugs. Mm-hmm. There's no quality control on drugs that are purchased on the street.
Right.
We don't know what we're taking. We don't know if the dose is what we expect it to be. We don't even know if it's the drug that we're buying on the street is what it is. And because of that, patients that we have, will often make mistakes, and it can be very costly.
Yeah, no, it's so true. You see that more so now than ever when fentanyl has been introduced and gets laced in everything, that people will be buying a Xanax pill on the street and they wind up overdosing, and the toxicology comes back fentanyl.
Yeah, and even we see that with methamphetamine as well. Mm-hmm. Unfortunately, there's a lot of patients out there that I've seen that swear up and down they're only doing methamphetamines. They come into treatment and they are having classic opioid withdrawal. And they're like, I've never done heroin, I've never done opiates, I only do meth. And when you're on the toxicology screens, you're seeing fentanyl pop up in their drug screens. And they have no knowledge of using any fentanyl, and they're having classic, opioid withdrawal symptoms.
So what would you say are the true dangers of fentanyl? It's popping up in everything, and we're seeing that that's commonly the cause for overdose today.
Yeah, fentanyl is the illicit opioid that's on the streets right now. Mm-hmm. It wasn't that way, 10 years ago. We've seen more and more and more fentanyl. It's quick and easy to produce. It's cheap to make, and it's being, brought here into our country. And rare is the patient who's only doing heroin. It's almost impossible to have a straight heroin addicted patient right now. Everybody is on fentanyl or one of the other designer opioids right now.
So are there differences between overdose symptoms for different types of drugs?
Yeah, there are. Again, when 3/4 of all of our overdose deaths are related to opioids. Mm-hmm. And the symptoms of opioid overdose are pinpoint pupils. Pupils are the black part of the eye. Mm-hmm. And you see them get very, very, we call them pinpoint or pinprick pupils. And shallow respirations, slow breathing, somnolence. Those are what we normally see in patients who are having an opioid overdose. They can also have like bluish tinted skin, dark colored lips, which are signs of cyanosis or decreased respirations, decreased breathing.
Yeah, it's like lack of oxygen.
Lack of oxygen. That is the mechanism of action for an opioid overdose, is the patient just stops breathing. And the scary thing about fentanyl that a lot of people don't realize is that fentanyl can kill you from your classic opioid overdose, but there's another phenomenon called fentanyl chest wall rigidity. And we know about this through our anesthesia literature because fentanyl was historically used as an anesthesia medication.
Okay.
And some patients will use fentanyl, and before it's even converted into before it's even before the fentanyl is converted into norfentanyl as the byproduct, the chest wall becomes heavy and stiff, and the patients aren't able to breathe.
Wow.
Not because of the effects of the opioids. It's like having a belt around their chest, and they can't breathe up and down. It's very scary, and we do see this as well. And unfortunately, when that happens, that's not usually reversible, as opposed to a classic opioid overdose. Alcohol, is a sedative. It's
right.
a different type of a drug. You see a lack of coordination. You see, stupor. You see slurred speech. And then they have trouble with mentation. They're not thinking clearly. Then they can vomit. They lose control over their gag reflex. And a lot of times they'll throw up, and some of it we call it aspiration, which goes down the wrong pipe, so to speak.
Yeah.
And patients can often die related to alcohol overdose as well. Cocaine, a stimulant, can lead to uncontrolled seizures. You can have a heart attack, or even a stroke from the use of cocaine, which increases the heart rate, significantly increases blood pressure. And instead of like with opioids, you actually will see the pupils we call that dilation. The pupils will enlarge in size. And you see that as a sign of intoxication through stimulants. But 3 out of every 4 overdoses related to opioids.
So I know that there is a myth or a theory that you cannot overdose on marijuana. Is that true?
I am not aware of anybody dying from acute marijuana ingestion. You can have a psychotic episode. I mean, you can have problems related to acute marijuana use that can be really, severe, and you may need to be hospitalized. I'm not aware of anybody that's died as a result of an acute marijuana ingestion, though.
Okay. So overdose deaths from opioids increased to 75,000 in a 12-month period ending in April 21, up from 56,000 the year before. Why do you think that is?
Well, and if you think about it, we've had a total of over 100,000 total overdose deaths in that same time period. And, the pandemic obviously played a large part in increasing the mental health strain on our population, between the businesses, the schools, the churches, the synagogues that were closed or shut down. And unfortunately, in a lot of our larger metropolitan areas, 12-step meetings were closed.
Yeah.
And our people that are in recovery, that rely on the meetings for their support, all of a sudden that was taken away from them. And some of them tried their best to do online 12-step meetings, but there's something missing there, that you don't get, in that one-on-one, work for one person in recovery helping another. And a lot of them, kind of got lost, and it became very difficult for people to get into recovery. I know of facilities that had groups that were, in treatment centers. I'm not talking about Banyan. I'm talking about other places. That had, patients in treatment, doing virtual groups. They basically were in in their room, almost 24 hours a day.
Wow. Leaving
to go eat, and all their groups in treatment were done virtually while they were in the building or in the facility. And to me, it was really made it really difficult for people who needed help and needed recovery to actually get the caring and the support that's necessary, especially in those early days of treatment.
Yeah, absolutely. I mean, they need that human connection.
Yeah.
They need to feel the love and feel the therapy that they're receiving. And I got to imagine it's super difficult to do that from a screen.
Yeah, absolutely. And the other part of that is, we briefly mentioned fentanyl a little bit earlier, and fentanyl, believe it or not, is 25 to 50 times stronger or more potent than heroin is.
Yeah.
So, it's, if you think about it this way, 1 milligram of fentanyl is equal to 25 to 50 milligrams of heroin.
Unbelievable.
It is. And so it's just because of that, I mean, it's really hard not to overdo it, even, by mistake, really.
It's interesting you bring that up too, because it's very important for people to realize how dangerous it is. Like, if you're walking down the street and you see a baggie, don't ever touch it, because you don't know what it is. I mean, there were a lot of cases early on of police officers, accidentally overdosing, being on the scene of something and not having, proper gloves on to touch whatever substances that they found. So I can imagine how easy it can be to accidentally overdose on that.
Yeah, it's frightening, when you think about it. So, it's just one of those things that it's awful. And the other thing about, why are we seeing more and more patients, overdose, is that there's a lot of people out there that need help, and they just don't have access to good quality evidence-based treatment. One of the reasons why, Banyan was so appealing to me is coming here is that we follow really strong evidence-based guidelines, and we try to do things the right way, for the patient. And, in this field, doing addiction medicine, I hate to say this, but there's a lot of, people out there that are not doing good treatment, and they're not providing evidence-based solutions to problems. It's sad out there when you have a patient and you have somebody who needs the help, and they go to a program that's not following the most up-to-date, guidelines and the most evidence-based treatment. I mean, you wouldn't send somebody, with cancer to go somewhere, without them, knowing how to treat their cancer.
Right.
It would be criminal if you think about it. So, Banyan, is doing everything the right way, and we continue to evolve and change our treatment programs as, the evidence, shows us. So.
Yeah. So let's talk a little bit about, empowering people that might come in contact with someone overdosing, right? Like, what should someone do if they discover their loved one is overdosing? How can we help?
Well, the first thing, and it's easy for me to say this on a podcast, is not to panic. Keep calm and, evaluate the situation and provide help and service. Narcan, if you have access to Narcan, and I would encourage everybody that has a loved one in their life that has an opioid use problem to have Narcan on hand. And I would continue to check it for the expiration date to make sure that it's still functioning as strong as it can be, and to use Narcan. And use Narcan. First thing, I mean, obviously after staying calm, you use the Narcan, you want to call 911 and then start performing CPR, you know. 2 rescue breaths initially, again, and then chest compressions. I would encourage everybody to do this. And, there are other things, like if you have somebody in your life that's addicted to opioids, you don't let them, be in a room with a locked door. You know what I mean? Like, you have to, some of these privacies that, you would allow other people to have, you cannot, give them, because, if they lock the room, if they lock the door and they're using, and they overdose, number one, you may not be aware of it. Number two, if you do become aware of it, you're not going to be able to get in.
Right.
So, it's very, it's sad to even be able to even talk or even think about these scenarios. But it's nothing to joke about. It's nothing, and then when they do have that overdose, then you got to get them into treatment.
Yeah.
It's very, very, it's easy to say, on a podcast, but it's difficult.
Yeah, absolutely. And I would imagine too, like acting swiftly, because time really is of the essence. I mean, do you know the statistics of, how how quickly an overdose can become deadly?
We don't have very much time, and having to act very quickly and decisively, is the most important thing to do. And that's why, using Narcan, and the quicker you use Narcan, the better the chances are of it working. Followed by, chest compressions and getting the ambulance on the site, as soon as you can.
So you brought up Narcan. Why don't you tell our listeners what Narcan is?
Oh, yeah, sure. Narcan is a mu opioid receptor antagonist, and that's a fancy scientific way of saying it's the antidote to opioid overdose. What happens in the brain, so to speak, is that Narcan will compete with heroin, with fentanyl, with other opioids that are on the brain, in order to occupy the parts of the brain that are active. And it's very, it usually wins the race, so to speak, between, fentanyl and Narcan. Narcan's going to win the race to get to the brain cells, and it will displace what's there already. And by doing that, it makes it much easier for respirations and breathing to return. Because again, it's the opposite effect, of the opioids. So it's not a drug. It's not an addictive medication of any way, stretch, or form. It's the antidote.
Yeah.
When somebody overdoses, and it's really, really important that if you give somebody Narcan, and they wake up, there's a couple of things you should know. The first thing is that they're not always going to thank you, and. And the reason for that is because you're reversing their high, and depending on how soon or how recently they've used and the strength of what they've used, you could very well throw them into immediate opioid withdrawal.
Yeah.
And immediate opioid withdrawal is not a fun place to be for somebody with an opioid problem. And so I want to prepare yourself that you're saving their life, and they may not be grateful and thankful to you afterwards. And the other thing that's important that you know about the use of Narcan, and again, it all depends on the half-life and what they were using. Going back to what I was saying earlier, you never really know what you're taking when you're buying drugs on the street. Is that the Narcan may wear off before the drug does. And if the Narcan wears off before the drug does, an hour or 2 hours later, so to speak, boom, they could have another overdose. So if somebody overdoses and you have to Narcan them, you have to get them to the hospital.
Yeah. And
they have to be observed to make sure that they don't need more Narcan, and to wait this out until they're we can be assured that their drugs are out of their system.
Yeah, it's a pretty common practice nowadays that somebody has to be Narcaned more than once.
Yeah.
Yeah. So so they get Narcaned and they have to go to the hospital to be monitored to make sure.
Without question.
Where can people find Narcan? Like if they have a loved one that's struggling and they feel like they'd have a little bit more peace of mind and want to keep Narcan in the home, where could they receive it?
I know that you can get it from the health department, and I'm going to show some ignorance of Florida law. I've only been in Florida. I haven't been in Florida for a year yet. But in many states, you don't even need a prescription to get Narcan. You can go to a pharmacy, a CVS, a Walgreens, and ask for it, and they will provide it for you.
Yeah.
And I can't speak for Florida because I don't know enough yet about the Florida, pharmacy regulations. But in a lot of states that you can do that. And if that's not the case and you're not able to get it, you can ask your own doctor for a prescription for it, and I don't think anyone would fault you for that. And the thing about Narcan is that it comes in a couple of different flavors or a couple of different shapes and sizes. There is an injectable Narcan, which goes by the brand name of Evzio, which is a really cool sort of a medication because it walks and talks to you. It actually talks you through the process of how to administer this medication, so that if in that moment, if you have that nervousness, that anxiety, and you get scared, it will tell you what to do, almost sort of like a defibrillator does, with the paddles, and they have the mechanical voice, the robot voice talking to you about how to do it. It's very similar. So there's that. There's also Narcan that you can get that's intranasally, which comes in a little syringe, and you just put it in the patient's nose and you squirt. And again, it all kind of depends on what is local and what's available in your own communities.
So what I will add in there also is that when it comes to Narcan, there are so many people that are looking for it, and overdoses have become so prevalent, unfortunately, that you can easily Google, how to get Narcan for free in your state, in your town, and there's a lot of online resources to find that. And we definitely encourage, if you do have someone struggling in your life, to have some peace of mind and maybe keep some handy, but always make sure you check the expiration date.
And I want to be very clear with everybody that's listening that it's not dangerous to use it on somebody who is not having an opioid overdose.
Okay.
So if you're in that situation and you see somebody that looks like they're not breathing, or and you're worried, like, oh my God, is this somebody that's having an opioid problem? If you give them Narcan and it's not an opioid overdose, nothing is going to happen.
Okay.
So you don't have to worry about making their problem worse. You don't have to worry about them having a problem or a side effect from the use of Narcan. If there's no opiates in the system, Narcan will just kind of go in there and won't have any effect because there's nothing for it to do.
Mm-hmm. So what happens to an individual after an overdose? Do they typically stop using?
I wish that were true.
Yeah.
I wish that were true, that we could scare people straight and they would have an overdose, and then you'd save their life, and they'd wake up and hug you and say, thank you, my God, this is a miracle, I'm so happy. And they would go to treatment and live happily ever after. And it's just, I wish that were true, but it's not. Again, sometimes you will have that person who will be happy that that you brought them back. A lot of times you're going to find that they are going to, what we call being in denial, and they're not going to believe that their life was at risk or that they were really overdosing. And they might even be mad at you for wasting their money, so to speak.
Yes.
They spent, they had to use a lot of their own resources to buy, use money to get money to buy drugs. And when you give them Narcan, you're inactivating the drugs that they spent money on to get, and whatever they had to do to get the money to get the drugs comes out. And sometimes the situations are not always happy and healthy. But, again, I'm not trying to scare you out of Narcanning somebody. I just want, you to be aware of the reality of what could happen. And I've Narcan people before, it's, so even in the medical field, and sometimes the patients are happy and a lot of times they're not,
Yeah.
But you use that, opportunity as an opportunity to try to get the patient, to try to get your loved one into help, to try to get them the care and the support and the attention that they need. Because if you don't, they're going to continue to use drugs. And this opioid addiction, since that's what we're talking about as far as use of Narcan, it's a medical disease. It's a chronic disease, and if all we had to do was scare somebody into stopping using, you wouldn't need treatment centers.
Right.
So you have to be aware that even in spite of an overdose, that they're not always going to change. And some patients overdose once and they die and you never hear from them. Other patients overdose 15, 20 times and they think they're invincible and they think that nothing's ever going to happen to them. Oh, sorry, it's sad. I'm not trying to be a Debbie. I feel like I'm downing you. I'm dropping making everybody sad here. That's not the point.
We'll spin with some positivity at the end. Don't worry.
I hope so.
Yeah, I think what you're saying is great in the fact of like, okay, let's try to use this tragedy, this moment, because it's a pretty big moment when somebody overdoses. You can't really kind of just like brush it to the side. Try to use that as the stepping stool to get them to get the help that they need. Like, okay, it's very apparent that there is a problem here. I don't know if we can continue denying this anymore. You just overdosed. You almost lost your life. Use this as a second chance. Let's get you in treatment. Let's get you the help that you need. And let's get you on the path of recovery. Obviously, we don't want to get people to this point at all.
No.
We want people to understand, okay, maybe I have a problem. Let's try to get better before they ever have to experience an overdose, because just like you said, you don't know if you're going to come back from it. But so what are some ways to avoid overdose aside from not using altogether?
Yeah, I mean, that's a really interesting question. Obviously, if you don't use drugs, you're not going to overdose. But unfortunately, there's really not a lot of evidence or a lot of guidelines about how to safely, use drugs.
Right.
I mean, you may find, some people talking about if you're going to use drugs, use with a buddy or use with a partner, those sorts of things. And that may sound good in theory. It doesn't really work, in reality.
Yeah.
So there's really no safe way, to use drugs. I mean, the best thing I can tell anybody who's still using out there is don't use alone. If you use alone and you nod out, there could be no way of ever coming back.
So
I thought we were ending this on a positive note.
I got you right now. Don't worry. So in your medical experience, have you witnessed a patient that has overdosed or maybe struggled with addiction severely and has, lived to tell the tale and recovered?
Oh, absolutely. Yeah, all the time. And, it's one of those things I learned early in my career that you cannot always reliably predict who is going to get into recovery, who is going to do well, and who isn't. And I have been surprised on more than one occasion for a patient that came in and had all the cards stacked against them, and you really didn't think they had a chance or a prayer in getting better. And then you see them, they come back for an alumni event a year later, 2 years later, and you don't even recognize the person. And they're like, thank you so much for helping me and saving my life. And, it's really inspiring, and it's really, powerful. And it's one of the rewarding things about doing this work is when you see somebody, a year later, 5 years later, who's in recovery and has turned their life around. And are living the dream, and it's why I get up in the morning. It's why I do what I do, because it's when people get into recovery, there's nothing better than that.
Yeah, absolutely. I know from my own personal experience dealing with an overdose myself, and learning what it was like for my family and my loved one. And then being in recovery and witnessing people overdose. I felt more inclined to help. Like I wanted to help because I had been there before, and I wanted to be there for that person because, kind of like what we talked about before, a lot of times people panic, they don't know what's really going on, but somebody in recovery can also, they can identify it faster than somebody who's not in recovery and doesn't have experience with that. So, just because you've overdosed in the past doesn't mean that you can't help somebody in the future. Walking down the street, seeing somebody struggling, and maybe somebody else doesn't recognize what's going on, but you do because you've been there before.
Right.
You can use that opportunity in your past, turn your mess into a message, and help people. There's so many people out there that need help. So do we offer any sort of educational groups at Banyan when it comes to overdose awareness?
Yeah, we talk to every patient during their history and physical about Narcan, and we do prescribe Narcan to our patients upon discharge. And it's sounds trite, but it's really the least we can do in order to try to prevent any problems when they leave us, because again we know the data and we know the evidence about not everybody who goes to treatment the first time gets well. And we want to make sure that they have every chance and every option and opportunity to get better.
Yeah.
There are people out there, that you will hear saying, listen, if you give somebody Narcan, all you're doing is letting them think it's okay to use because they have this get out of jail free card, that they have. And that's just not true.
Yeah.
And I want to dispel anybody of that delusion that providing Narcan to people is encouraging them to use drugs. It's not. You have an airbag in your car, you're not encouraged to drive off the cliff, but if you do, thankfully you have that airbag that can help you. And then but the thing about Narcan is that it has to be given by somebody else. As the individual using heroin, using fentanyl, if you're in a position where you can Narcan yourself, you really don't need it.
Right.
It's really for patients who are not breathing, they're unconscious, they're somnolent, they stop breathing. I mean, it's not something that you can give yourself. Somebody else has to administer it for you.
Yeah. So what do you think is the best recommendations for someone to have success in recovery? Like, do you think it has to do with how much treatment, what they're doing outside of treatment? Right. Give us a little insight on that.
Yeah, sure. What we know, and I speak from an evidence-based standpoint, is that the longer somebody stays in treatment, the better their chances are. Whether that's, they come in and they go through, medical stabilization, followed by residential, followed by, partial hospitalization, followed by intensive outpatient. The longer you stay engaged, the better your chances are. If you're on medication that helps with cravings, that also increases one's chance of getting into recovery. Having, family support is very helpful. Having, 12-step, support, through a sponsor and through a home group, and, being able to connect to other people, with the illness, and then being able to, kind of get out of yourself and give to others, and people who do that and consistently, try to help the next person. Those are the patients that get better and stay better for the long haul. Again, like I said, there's no magic way of predicting that patient, based on, how, their age, their sex, their finances, when they come in the door, like how they're going to do or what they do for a living. It's an inside job, and internal changes have to be made, for the patients to get into long-term recovery, and it's very possible, and millions of people, are walking the walk and living the life in recovery. But there's no way of, predetermining, who that person's going to be, and whether you're in treatment the first time or the 10th time. There are sometimes, there's a saying that it takes what it takes, and I would just encourage all of you, if you have a loved one that's that's struggling with this illness, is do not give up. Do not stop loving. Do not stop caring. There is a chance.
Yeah, absolutely. So we'll give you the tools to succeed. We'll give you our medical recommendations, which is stay in treatment as long as you possibly can, as long as you're able to, and give yourself that chance to heal.
Yeah, I mean, the brain, it's broken, in a way. And, if you think about it, if you break your arm, you put your arm in a cast and you wait it out. You don't, how long do you think it would take to fix your arm if you didn't wear a cast and you just kept bumping it against the wall all day, every day? We can't put a cast around the broken brain. The brain has to think, the brain has to feel, the brain has lots of activities it has to do. So again, it's sort of like having a broken arm and just keep bumping into it all day. It's going to take a lot longer to heal. And the brains, in patients with addiction, are a little bit broken, and it takes time for the brains to heal. But the good news is that they do heal. You know,
recovery is possible.
Oh, it is the expected outcome of addiction treatment.
What would you say to someone looking to get help for themselves or a loved one?
I would say that the most important thing you can do if you're looking for help for yourself or a loved one is to not wait until it's too late. There's no better day to get into recovery than today. There's no better, you don't want to wait until, we're going to see after the holiday or after the birthday,
all the time.
or I'm going to finish the semester at school, or I'm going to do this or do that. If you're using drugs, if you're drinking all the time, that day may not come.
Yeah.
Or you may not make it through the semester. You may flunk out before that. So there's never. I would just encourage everybody not to delay. Just like if you found out you had a tumor somewhere, you're not going to delay your life in order and say, I'm going to wait another 3 months before I get this tumor looked at. You're going to drop everything and get the treatment. And I would encourage everybody, who are worried about this, and go to a reputable place.
Yes. And
there's and I can't stress that enough. You want to make sure that when you call a place, and again, I love Banyan, so I'm not going to tell you everything about Banyan, but in general. Are the doctors board certified in addiction? Are the counselors at least master's level therapists? Are they licensed? who is there? Are they accredited? Who has accredited them? These are all important things. You don't just want to go to the local, detox, in town, or the local treatment, the drunk tank or whatever you want to call it.
Yeah.
You want to go to a place that has professionals that understand this disease, that have been trained to treat this disease, and have the proper tools, to help you. And and that's really, really important.
Is there anything else you want to add?
I just want everybody to know that, addiction is a treatable medical condition, and people recover. Recovery is the expectation of treatment, not failure. And, I want everybody to know that there are places to go, and there are facilities that can help your loved ones or yourself. And this is nothing to be embarrassed about. This is nothing to be ashamed about. There are people, in my career, I've taken care of, people from Yale to jail. I mean, it doesn't matter who you are. It doesn't matter who your parents are. It doesn't matter what your job is. It doesn't matter how much money you have or how much money you don't have. This is an equal opportunity, offender. Just like diabetes doesn't care how much money you make, just like hypertension doesn't care, what kind of, where you live, or, it's an illness, and we have to treat it that way.
Well, thank you so much, Dr. Mangiacarni, for being on today.
Oh, very kind of you to say that.
Of course.
I'm happy to be here.
I'm looking forward to having you on in the near future to speak on more topics and get your expert opinion. So thank you again.
Well, thank you.
We hope you enjoyed today's episode. Remember that growth and recovery are possible, and it can all start today. Be sure to follow us on Instagram and Facebook at Banyan Treatment Centers. Make sure you're subscribing for notifications of new episodes, and don't forget to leave us a review. If you or someone you know are struggling, call us today at 888-515-7706. Thanks for joining us today on the Banyan Podcast.